my name is Laura Cinco. I use she, her pronouns. I am an assistant professor at Temple University in the Department of Nursing in our College of Public Health. I also am the director of research and survivor support at Our Wave, which is a nonprofit online where we help survivors find healing in different ways. And so my research really focuses on the survivor healing journey, what that looks like. And I'm always trying to think about different ways we can learn about the survivor experience in a trauma-informed and creative way, because healing is often so much more than we can describe with words. And you'll see a bit of that today. And so we conducted a needs assessment. We are the Phoenix Gender-Based Violence Lab at Temple University. Kaylee is my wonderful research associate and has rich experience working with survivors and really just supporting on all the different projects that we have going on. So we're excited to share what survivors shared with us. We had a bit of some listening sessions with professionals and then the general public. So I'll start by sharing a bit about our approach. So we started with a national survey, which we had 645 folks respond to, which is so exciting. There was a lot of interest in this topic, and I think a lot of really great insights that were shared. We then wanted to take a subgroup of folks that identified as survivors and bring them into focus groups and get some more information about their experience, barriers they faced, and what needs they have going forward in their survivorship journey. And we also had some listening sessions with professionals when we were at NSAC and gathered some of their perspectives just to make sure we weren't missing the mark when we're thinking about needs in a very diverse way. And we also have we had a survivor advisory board that guided us throughout this process. And so they helped us look at our survey, make sure that the questions seemed appropriate, the order made sense, that it felt safe to take as a survivor. And they also guided our interview approach to really make sure we're really centering the survivor experience at all levels, because the best data is in a space that feels safe and comfortable to share. So really appreciate their support with that. So I'll share a bit about the different methods, but I wanted to start a bit with photo elicitation because it's maybe a method some of you maybe haven't heard about or haven't used much. But I think it's a really cool way to gather some of this information that we were looking for. And so we had 12 survivors across 4 focus groups do this. And so we gave them a prompt where they could navigate their typical week or really just reflect on things in the past that are relevant to them, and ask them to photograph things to represent different gaps or barriers in services, as well as maybe things that were supportive. And so we asked over the next week, use your cell phone or personal camera to either take pictures or use pictures you've already taken that represent things that was supportive or meaningful to your healing journey. So things like resources, services, spaces, practices. We won't share any people's faces, but if people did get others' consent to have their faces to share their experience, they were welcome to do that. And this could be formal services or more community support or self-guided practices. And then we also ask them to identify gaps or barriers or unmet needs in their experiences. And so this could be images that they wish they were available, barriers they faced. And so sometimes people would use photographs to represent those feelings. So, like empty spaces, closed doors, or any symbolic representations that could help them share those needs and really think through them before we got into the focus group space. So our national survey, I'll also share a bit about our methods. So that was distributed broadly. You can see a bit about the distribution of this survey. We asked a bunch of different questions. I won't go through them now. You'll see most of them in our results. But we asked about different barriers, needs, what people were already using, what they wish they had available. And this was open to anybody. But we did have some specific questions if they were a survivor themselves or if they were actively supporting someone who experienced violence in their life. And so you can see here, we had a pretty good distribution across all of the states. We just didn't get someone from Maine, unfortunately. But other than that, we had a pretty wide distribution. Um, and so 42.3% identified as a survivor. 27% were actively supporting someone who was a survivor, and around 22% said, I don't really think I know a survivor, but I'm just a concerned member of the general public. And around 8.2 were unsure if they were a survivor, which is not surprising. We know that identifying those things can be quite tricky. So I'll share a bit about the folks that we talked to. So in our focus group, they were all women, ages 25 to 64, with a different variety of race and ethnicities, and a good percentage of folks reported disability, 75%, most of them being some variation of neurodivergence or mental health concerns, chronic health concerns, or physical disabilities. And so just to flag here, this obviously tells us a little bit about the folks that we talked to, and this smaller group was not representative of our larger population, notably all women. So just as we're thinking about these findings, I want to put that in that context. This was a rapid needs assessment, and so if we had more time and more funding, we would love to expand that more, and perhaps we will in the future. And then for our survey, we had 645 people with a good distribution of women and men. Um, and then also with age, folks were around 25 to 54, but we had a good distribution in age, race and ethnicity, and location. So we had a bit of an equal distribution of urban and suburban, but less with rural survivors. I probably some of the nature of that is because it was an online survey, but of course not always. And so again, when we're thinking about the generalizability of what we're talking about, just keeping in mind we need more rural perspectives. So I'm going to share some like general larger findings. And then I'm sure we'll have time for questions, and I'd love to get into even more because there's so much out there. This was really just a snapshot of some of the things that we found. And so I'm going to start by just reminding us of, again, we did this survey where folks filled things out. And then just to give you more of a sense of the focus group process, individuals went through that photography activity. They then shared two photographs with us they'd be willing to share in a group. And we got people in groups and we had them share their two photographs, the stories behind their photographs, how it represents their survivor experience. And then at the end, we asked some more general questions to the group about needs, barriers. And it was a really cool experience because we saw survivors from very different walks of life connecting over these different pieces. And more than once, in nearly all of our groups, at least someone said out loud, it feels so good to talk to somebody else who's experienced these things. And so I think it just really points to that importance of bringing survivors together and using their wisdom to try to better services to support them. So I'll start with our first finding, which was about body-based healing. And so there was some concern that insurance might not cover some of these more holistic healing modalities, especially these more somatic or mind-body connection experiences. And so folks described trouble accessing and paying for things like EMDR, somatic experiencing, different movement therapies, and felt like these were often disconnected from traditional mental health talk therapy approaches. And it felt like they were kind of viewed as like more like fluffy or like a nice to have, where so many felt like that was a need to have for them because so much trauma was being stored in their body. And so one survivor said, I'm not gonna think these things live in my marrow. I have to sit with them until they shiver out. So it's really sitting in the body for these folks. Another finding that we had is that healing is individualized and not standard. So often folks described going to a certain place and they had like a packet that everybody got. And they felt like that often wasn't helpful, only because there was so much variation in experience. So for some folks, things might have happened days before. And for others, maybe they were in their 30s or 40s reflecting on a childhood experience. And so they felt like they could really use some individualized case management and goal setting. And some folks did get that in different spaces, but a lot of folks did not. And so many reflected that services right now are great at crisis management, but maybe less effective at tailoring resources based on where survivors are in their healing journey. And so one survivor shared, every survivor has gone through a different experience, has different needs. I don't understand why that concept hasn't been passed down to other forms of support. And this survivor was actually referring to like IEP plans in schools. So for children who have different learning challenges or behavioral challenges, kind of having that personalized plan to help them be able to participate in school, they sort of felt like having something like that to help them engage in the different facets of their life would be really useful. Another finding, which is probably not surprising to many of us on this call, is that long-term support is needed. Um, a lot of folks reflected that most of the free resources were focused on crisis response, with maybe a couple counseling sessions, but kind of limited long-term options. And so some survivors came to terms with their trauma later in life and didn't really know where they fit. If they were a child when they experienced it, but they were now an adult, they really wouldn't go to children's services, but they often felt like, do I go to a rape crisis center? Is that where I belong? And just kind of feeling a little bit like in between some of these systems. So I think that also really points to messaging, right? And how we do want folks to come into different sexual violence services, no matter where they've experienced harm. But I think sometimes the messaging might make some people feel like maybe I don't belong here. Am I taking up space from someone who's in crisis? There was a lot of concern about like, do I belong? Which was really interesting, and I think just again points to this idea of how can we message to help all survivors realize that they belong in these spaces. And so one survivor shared, we're not a survivor just when it happens, we're a survivor decades later, and we're still dealing with very difficult things. And that might change over time too, pointing to the individualized support needs. Another finding, again, probably not surprising, is that connection really breaks isolation. So it sounds quite simple, but people were still really just begging and pleading, like looking for a place where someone could listen without judgment, help themselves feel less alone, and really meeting other survivors. There was a lot of requests for online support, group therapy, all of these different things. And those can be hard to find, especially with identity-based groups and things like that. But for those that were able to find it, that felt essential to their healing. And like I shared earlier, even the focus groups that we did together felt a little bit therapeutic in a sense, having that solidarity, sharing your thoughts and feelings. And so many were like, wow, I wish we could have more of that. Even just the resource sharing of books people liked and things that were helpful, people were sharing in the chat. So it was kind of a cool experience to just see like what survivors can do when we put them in the same room. And so one survivor shared, that connection has probably been one of my biggest keys to my healing. We might not have the same experience, but we know. So now I'm going to share a bit about the critical needs that we found through our survey that kind of support some of the different things we found in the focus groups. And so again, some of these are kind of like obvious, but the fact that we're still naming this shows that it's an important need. So this was a blank text box, and we said, what do you think are the top three most critical needs? And Kaylee did a wonderful analysis, putting this all together to see what people said. And so the main thing people said was support and belief. Like, I just want to be believed. I just want to be supported without judgment. I just want to feel valid in my experience. Um, and that can happen in all sorts of ways, right? But unfortunately, that we're still hearing these things. And I've been in the research world for a bit and been reading a lot of papers and have read a lot of papers. And folks have been saying this for years and years and years and years. So I do think we're getting a lot better in this, but I think being creative and innovative about how can we increase support and belief in different ways is seems to be what folks are really looking for, as well as safety and justice. So people shared things like more reliability, calling 911, clearer pathways to justice and accountability, including legal support, thinking about justice in a multidimensional way within the criminal legal system, but also potentially outside of it. And then healing and recovery. We need more focus on that of life after. And I know I'm a sexual assault nurse examiner, and I very much often in the clinical world work in that crisis. And it can be really tricky to have a conversation about healing that early on, but often weeks, months later, that when folks are ready to begin to engage and think about that process more deeply, they often don't know where to turn. So here's a word cloud of some of the things that came up when we asked for these critical needs. So you can see support, access to therapy, resources, safety, medical intervention, justice. So all of these words, I think, really show the previous slide a little bit better in the actual words that people were using. And so we asked people service preferences. So, how likely are you to use the following resources? And so we had online services. A lot of folks were sharing they just kind of want a one-stop shop informational website. Like, wouldn't it be great if I needed help? I go to this website and I could see my options. It can help me make decisions. I can help figure out if I even what I experienced was violence. So all of those different things. Um, are really, really important, I think, to just centralizing all of the great information that's out there and weeding out the information that's not so great. Also, online support groups really rose to the top, as well as virtual therapy and counseling. A lot of people are living in the online world now and just wanting more online options. And then, yeah, even down to like mobile apps, right? There's so many out there, right? But I do think that do we know they're available? What's actually evidence-based? What's actually potentially helpful? So I think a lot in the online space. And then for in-person services, individual counseling and therapy rises to the top, along with medical and forensic services, um, and sexual assault crisis centers, peer support programs, support groups, things like that. And then finally, holistic approaches. So mindfulness and meditation, a lot of folks kept bringing up as winning more access to these resources, as well as just kind of self-help books and survivor publications. I think really speaking to this idea of wanting to tap into the wisdom of other survivors who are maybe further along in their process. There's a little bit of distrust in systems. I'll show that in a slide coming up, but I think people really trust other people who've gone through these things, and getting access to that information can be really helpful along with nature-based healing, a lot of lovely photographs of nature as being really supportive of healing, movement or body-centered practices, and then art therapy and creative expression. With these last three, I think being often hard to find, especially in areas that are a bit more rural and also hard to cover um, if they're not typically covered by insurance. So we asked where folks got information about sexual harm. So a lot of people are getting, not surprisingly, information from social media, which is great in the way it can connect people and distill down complex information into very simple graphics or ideas. But as we know, it can kind of be a lawless land on social media, and we don't know what type of information folks are getting and how accurate it is. They're also getting some information from the news media, friends and family, and then different websites. So as we're thinking about where we want to disseminate really useful information, we want to meet people where they are. So equally important, where do people find support services? People are using search engines. Not surprising. And we know, unfortunately, a lot of really great nonprofits don't have great SEO or don't really have a great way to index themselves on Google because we don't often have full-time tech teams that are working on these things. And so often they can get buried. And so thinking about when we are searching these really important questions that are common or information, what's coming to the top and is that information accurate? And then of course, social media, healthcare providers, friends and family, etc. So we asked survivors what services they used and if they used any. And about 60% said they used some sort of service or sought some sort of support, which could include friend and family support. So really just like, have you told anyone? What have you done? So I think that's why that number is a little bit higher than other surveys that I've seen in the past. So we did include informal support. But that does mean that 34% of folks are really kind of living with this weighing heavy on their heart all alone, and that's too much. Um, but folks typically use mental health counseling or therapy, family or friend support, medical care. Some use support groups, online resources, etc. So we asked them some barriers to seeking support. Uh, and what really came up is things that we see in different spaces a lot. So the stigma and shame. So those sort of internal barriers that people experience, or external, what they see other people go through. Survivors can be very observant, like we all are, right? And if we feel like the people in our environments are commenting on news stories in a way that's not supportive of survivors, or if our families are talking about harm in a certain way, that increases that shame and increases that barrier. A fear of just disclosure in general. What might that mean? How might I be labeled? Cost and insurance issues, and then a fear of not being believed. And so, even among folks who did seek services, because this was across anyone who might or might not, 85% still feared not being believed. So they were sort of still having that fear and still chose to seek services anyway. So we can overcome these fears, right? When our needs are high enough. But how do we message or create situations or environments where this fear can be decreased to decrease that barrier? So we asked survivors what they wish they had, online or in person. Um, and so really what rose to the top here are better online options. So things like telehealth apps, forums, other ways to connect with survivors online, um, and then affordable, accessible therapy, which again is not very surprising. Looking for support 24/7, which is again hard to do in many spaces, but important. And then peer support and clear information and step-by-step guidance, for folks that didn't have access to an advocate or someone to help walk through the process with them. So I'll share just some example barriers and potential solutions. We talked a little bit about barriers and solutions and dreams in these focus groups. And so one example barrier is that a survivor shared that another person in the group agreed with is that they wanted to go to seek a shelter because their situation was happening in the home. But then they felt like they couldn't because they had a pet that was so crucial to their healing, and that the place didn't allow dogs. And so they ended up couch surfing, living in their car just to keep that pet with them. And so survivors talked about pet friendly emergency housing options, temporary pet care services, things like that. Another barrier a survivor mentioned in our focus group was reimbursement offering covering travel to billable medical appointments, but not free survivor services. And so we are so fortunate that so many of these services we provide free of cost, but then the transportation to get there was not accessible. So this person really fought to get that reimbursed, and she was reflecting, well, if I was earlier in my healing, I would not have had the energy to fight that battle and I wouldn't have been able to make my appointments. So, thinking about transportation assistance for accessing no cost support and how can we better advocate, um, for these different things, that these services are still essential, even though they're not billed. Another barrier, some survivors, especially those who are receiving low cost services, kind of felt like training cases for inexperienced trauma therapists. Um, and so folks dreamed about what if we could have kind of like Yelp, like a survivor vetted provider directory, or you could like give feedback and sort of see these folks who have experience with trauma actually do a job that feels right by survivors. They're reflecting like on Psychology Today how like providers can add their own specialties and it's not really vetted by the people who are actually experiencing their services. Um, and then the last barrier I'll share is that among survivors who did seek services, 51.6%, so about half, felt their experience wasn't serious enough to seek services and had to overcome that and delayed often for a long time because of that. So again, points to, I keep saying messaging, but this idea we know that all experiences matter, but so many people don't want to take up space. They're afraid that they're going to be um, it's going to be minimized. They're not even sure what to label their experience. So again, I think that that messaging piece is really important. We talked a bit about digital resources because there was such an interest in online supports and improving that. And so we asked if you could rank your first, second, and third priority for these digital resources. What is most important to you? So you can see here, people's first priority was that light blue. The second was like the mid-tier blue, and like the darker blue was their third. priority, and they can only pick three. And so when we're looking at this graph, we can see anonymity and privacy is number one by a long shot, which is kind of surprising to me, actually. We know that these experiences can be so stigmatized and we have could have a lot of shame when we go through these things, but it really points to we really got to think about privacy. And so as we're building online services, we have to make sure that the our digital infrastructure is secure enough to ensure that survivors feel safe using it. Another important thing that rose to the top was 24/7 availability. I think the reason why folks want online spaces is so they can access it when they need it. And so many people reflected that often their job is a 9 to 5. And so a lot of like the in-person services aren't available in the evenings or not evenings that they're available with childcare and things like that. Another thing that was important to the top is evidence-based information. So making sure where is this information coming from, and are we continuing to do research in this area and make sure we're getting the most accurate and up-to-date information, as well as trauma-informed design. And then you can see all of these other different priorities that we shared where we didn't have a lot of rural folks. And so I think that might explain why like low data usage was as important, but we're also getting more and more accessible internet these days. And so I think in the prioritization of things, that one really didn't come to the top as much. So I'll share a couple photographs here, just to give a taste of what folks shared with us. So one person took a photograph of like an ice tray and said the treatment I got from him, and this was referring to the person she was, actually this was her physician who she was disclosing to. Um, he was just ice cold. I felt like I had committed a crime, and so she took a photograph of that ice. And this was a primary care provider, and folks in that group really reflected that in spaces that maybe they come across less survivors, that trauma-informed approach is even more important, because that's often like the one place they have they might share something. And she happened to be in her primary care appointment and kind of broke down, and this person felt very overwhelmed and a little bit ill-equipped, and it showed in his response. Um, and then over medicalization was another thing that survivors talked about. So a lot of folks reflected on this idea of like trying to medicate things away and that not working. And so one survivor shared, my drug dealer was my doctor. Here's a prescription for Xanax. Here's some Zoloft, kind of just like go home. And so that felt very dismissive, but also potentially perpetuating some ways of, they were looking for more options than just that. Uh, and so trying to make sure that we always think about that first. So a couple more slides, and then I'm really excited to get some feedback from folks and just open the floor. And I know this is kind of a dense PowerPoint, so I am more than happy to share this with folks. Um, we asked a bit about system confidence. So, how confident do you feel in these different survivor support systems? With very confident being that lightest light um, bar, and then not at all confident being that darkest bar. And so, as you can see here, the places with the lowest confidence was workplace HR departments. Um, Not super surprising. I do think oftentimes survivors have the perception that HR's job is to kind of cover the interests of the business or the corporation or wherever they're working. And so I think it points to more education there on being supportive of survivors in those spaces so they do want to come forward. Also, some distrust in law enforcement and the criminal justice system, with the highest confidence being healthcare systems and different social services. Um, so I do think it's, again, really points to this idea of healthcare, actually, even more than the other ones, is really rising to the top. And I think people often like are a part of healthcare systems more frequently just across their life, just more comfort in those spaces. And so, how can we really equip providers in different healthcare spaces, especially ones that don't specialize in survivor care, uh, to really feel like they can appropriately respond to disclosures and triage? I think is a really important intervention point here. And so we asked folks what systems feel the least safe. And so you can just sort of see here as it goes down. what folks feel like is least safe. And again, there's been a lot of historical harm with law enforcement and police and present harm. And so I think there's been a lot of friction in that way from the general public's perspective and survivors. So we asked a bit about prevention priorities, and it was sort of interesting to me seeing the high distrust for law enforcement and the criminal justice system, and then still with prevention priorities, thinking about stronger legal penalties. So there really is a tension there between wanting better criminal justice supports, but also being very critical of what's happening right now. Um, People also were looking for better school education programs and improved law enforcement training. So there still seems to be like this hope that we can improve these systems, at least from the eyes of general public or survivors, but feeling like maybe we're not quite there yet. And then we also ask people just general, what questions do you have about sexual harm? Like what are things that you feel like are unanswered? And we classified these, Kaylee did, in these different categories. So things about like prevalence or statistics, like clarifying. Some of our statistics are pretty not up to date, and just kind of wanting to know in general what's actually happening. Some stigma and cultural barriers. So thinking about that and how we can shift culture. Again, big questions. I wish I had the answer to that, but good questions to ask. Thinking about prevention and systemic change, justice system questions and accountability questions, um, better ways to support survivors. A lot of questions about how I can support, what should I say, who should I go to, and then definitions and understanding. And this was a big one. Labeling your experience seemed really tricky for folks in this climate where there's a lot of social media and words being thrown around and their own experience. And so a lot of people were wondering, like, did my experience count? How do I know if it was abuse or harm or things like that? We also did ask professionals their perspectives at NSAC. And so we asked them what they feel like the most pressing challenges are in the space. What are some positive trends that they're seeing that they kind of give them hope or they wish get more momentum? And then what sort of solutions might be the most helpful, or if they have any solutions of their own? So I'll just summarize a bit here, just to complement some of the needs assessment work we did. But there was a big emphasis on housing and transportation barriers, which really was aligned with some of the things we saw in our survey. I think professionals were more aware of the funding and workforce strain, of course. We really experienced this chronic underfunding, these grant restrictions, staff burnout, turnover, low retention. And then these service and system gaps, which again, I think really dovetail nicely from what we found in our needs assessment. So, really wanting more long term mental health support, specialized care, improving institutional trust and legal advocacy, and then also the cultural and language barriers, particularly for marginalized communities. Some positive trends was this like collaboration and community. So thinking about some like creative partnerships between different orgs. I think often, unfortunately, we can have this scarcity mindset. And so how can we come together to work together on these larger problems? And there's also been some braided funding that has been very promising as we think about joining forces and moving forward. Also, peer support, collective care, all those things seem to be very useful and helpful. And so, how can we increase that capacity in different areas? Innovation and cultural shifts. So, there's been like some trauma recovery centers trying to be more holistic in the way we approach trauma recovery. How cool. Flexible funding so organizations can really do what they need and what they know can help survivors. Um, Better virtual platforms to increase access, restorative justice, and youth leadership initiatives. And then finally, prevention and inclusivity. So, school based prevention programs, social media outreach and activism, and just like broader survivor engagement. So, the more we can get older adults, men, LGBTQ folks, different pieces into the conversation, the more that we can really think about how to make sure our systems are working for all survivors. And then finally, solutions and recommendations. So for funding and sustainability, um, folks are talking about survivor centers versus rigid mandates. This idea of like flexible and unrestricted funds and grant writing training and mentorship. Because as we know, grants keep our things running. And so how can we make sure that these organizations that are doing really good work can really communicate that good work and get the funding that they need? Workforce well-being. So thinking about leadership development, pay equity and turnover solutions, different self-care and innovative practices, community care, thinking about how can we make sure that folks that are in this space can stay here as long as possible, as long as they want to, and that we're creative, supportive environments that are equitable and pay fairly in these different ways. And then finally, systems level change, things we've already talked about, but training for law enforcement, train the trainer prevention models, and expanding community-based services and collaboration. So again, these solutions and recommendations uh, by professionals who are speaking with us at NSAC. So, some immediate opportunities to wrap up. So, access improvements. So, I think enhanced messaging about ongoing support availability is really helpful, especially as these times are making services really shift what they're able to do, the funding they have, really making sure we're up to date and updating survivors in that process. Um, I do think this idea of survivor vetted provider directories is quite interesting. It's quite a task, but it's something that I think is worth thinking about. How can we make sure that we're getting feedback to providers, but then also sharing some of that feedback with other survivors? And then warm handoff procedures between services. We know this is best practice, but it's often really hard to do that. And so, how can we create systems that make it easier for folks to do those warm handoffs? Um, as well as barrier reduction. So, thinking about anti stigma campaigns, a lot of those on social media have been very successful. Can we continue those efforts? Financial assistance programs, there's a lot of cool nonprofits doing work in this space and trying to expand that. And then thinking in general about transportation policy reform with some of these reimbursement challenges people mentioned. And then some practical suggestions that survivors shared that we thought were interesting and worth just saying out loud to see if anybody is inspired. So one group of survivors shared that creating platforms where survivors can ask questions without stigma, access support at any time, and connect with peers who have similar experiences. So I think that really just getting that real-time feedback and quick support can be very helpful here. Um, Building trauma informed apps that send supportive prompts or reminders. So we there some of these are out there, CBT, et cetera. But really trying to help survivors reconnect with themselves during numbness or disconnection. Step-by-step guided reporting tools or help seeking tools. So like flowcharts, interactive apps, or infographics. So like really decision making support seemed really helpful, especially in an online way where they're just Googling things. And then 24/7 text or online support. So thinking about more making it accessible at all different hours for folks with different schedules. And this is like the wish list, so bear with me. But I do think a lot of these are really interesting. Creating community-based drop-in support hubs, so local spaces that combine emotional support with practical aid. So I know that folks were often sharing like if we're thinking of like the hierarchy of needs, like that space support of getting housing, food, childcare is often critical to be able to engage in some of these more healing-based modalities. um, Maintaining online directories of trauma-informed therapists, uh, and then developing resources responsive to male and underrepresented survivors who often feel like maybe their experience is not reflected in the general service ether at the current moment. And so to wrap up, we really, one survivor shared, we underestimate the village and how much power that can bring to us as a whole. And I think we all are a part of that village. And so the more that we can really make things easier for survivors and come together with all of our different skills and expertise, I really do believe we can improve this infrastructure. And it was just really cool to hear all of these perspectives and insights.